Good evening, everyone. A very warm welcome to all of you in fifth session of this internship program, organized by Forensic Mindset and founded by Ayush Vikram Singh. I am Priya Bharti, a team member at Forensic Mindset, and I'll be host for this internship program. It's my pleasure to introduce our esteemed mentor for today's session, Dr. Somya Soin, ma'am. She is a senior dentist and holds an M.Sc in Forensic Dentistry from NFSU. She is also UGC NET Qualified in PhD category. She has completed internship at the NCRB and FSL Delhi, and her expertise includes forensic details identification, forensic anthropology, crime scene investigation, and clinical research. She has also conducted practical training for police officers and actively contributed to research through national and international conferences. We are delighted to have such an accomplished professional with us today. So please join me in welcoming Dr. Shami Shoin, ma'am. The floor is all yours, ma'am. Thank you.
Thank you very much. I'll just be sharing my PPT now. Please let me know is that visible or not. Just give me a second. Good evening, everyone. I hope the PPT is visible.
Yes, ma'am.
Okay, so basically today we are going to start with our first lecture in forensic anthropology. First of all, forensic anthropology is basically, whenever you are talking about forensic anthropology, it includes the physical anthropology aspect. Okay. And then what we are actually doing, we are studying the bones. We are studying whether you can, differentiate between the populations through the bones, or you can just get to know about the sex or the age of the individual, how the trauma actually got inflicted, what was the nature of injury. Even in cases of postmortem, if you are getting certain skeletal remains, you just try to understand that actually what happened, how the death occurred. So all these things, you know, uh, basically come under forensic anthropology in nutshell. So let's dig deeper today into this topic. So, if you talk about the definition, right, if we decode it, if we break it down, then you can understand that it is basically a subfield of physical anthropology that involves the skeletal analysis and techniques that are basically applied in archaeology to solve the criminal cases. So, whenever we are talking about a forensic anthropologist, that person basically, goes to the site, the disaster site or the archaeological site, where basically the remains are found, the skeletal analysis needs to be done. So, as I already said, that it involves osteology, taphonomy, the condition of the dead body, what happened to the dead body after the death, and the contextual interpretation to assess investigations and courts. So basically, we are going to understand each and everything in little detail today, and I'll just give you a gist of forensic anthropology through today's lecture. Okay, it is very important to also understand that it has a lot of significance in disaster victim identifications, in medical legal cases, when we are trying to identify the individual positively, trying to reconstruct the biological profile. So all these things come under the forensic anthropological aspects. So Thomas Dwight is also known as the father of forensic anthropology due to his many great contributions, his basically his texts also. So in a nutshell, it was about forensic anthropology, the basics, right? So when I'm talking about a crime scene or if I'm talking about an archaeological site, so how do you find a forensic anthropologist? What actually the forensic anthropologist is doing, right? So basically, forensic anthropologists, assess the archaeologists, the pathologists, and that forensic anthropologist's main role, the major role is to document whatever he is seeing there on the crime scene, whatever bones, the thing that basically, needs to be analyzed are the bones only here, right? So basically, the anthropologist needs to document the scenes, how the bones are present. You all are aware that we do photography, right? So the anthropologist's role is basically to understand how the remains were found. What was the positioning? To document all the stuff, whatever he or she is, seeing at that time, recover the remains. Now, when we are talking about recovering the remains, it all depends upon how, the remains are found at the crime scene or at the disaster site or archaeological site. Okay. So if I'm talking about an archaeological site, and for example, there are, 4 to 5 skeletons found inside, you know, they were basically exhumed. So when the archaeologists were trying to recover the remains, the skeletal parts, so basically anthropologists needs to first understand what are the right sides and what are the left sides of the bones. So basically this bone belongs to the right side, this bone belongs to the left side. That anthropologist tries to, fix and try to make the skeleton complete through whatever bones he or she is encountering at the archaeological site. All right. So basically, that person has this role that, okay, whatever he is, seeing there, just document it. Try to recover the remains in such a way that the handling is proper. Gloves are used. Okay. And also the each and every skeletal remain. For example, there are certain fragments, right? Fragmented remains that are also collected properly in basically certain sheets so that it depends upon country wise how they are collecting the remains. So basically in sometimes the bones are so much small they try to just put it in the cardboard boxes, and sometimes they introduce certain sheets and like on those sheets, cellophane sheets, you can say. But in India, basically people are trying to, use paper more. Okay. So on the paper charts, the chart like sheets or whatever you can say, according to the availability of each and every lab, each and every, team, forensic team, they try to analyze, understand, photograph, and document each and every bone. Okay, so whatever bones, if for example I was talking about a scene where 4 to 5 skeletons are found, that anthropologist tries to, understand and relate, okay, the size of the bone, what is the size of the bone here, and what is the size here. If the skeletons are of, a child, and if the skeleton is of an adult. So the bones, and if I'm talking about two adults, a male adult and a female adult, so how you can understand that, okay, this bone basically has this, inclination towards the female sex or towards the male sex, according to that complete skeleton is formed. So it's very complex, but if you are good at your foundations, if you understand the concept that, okay, how the bones are, arranged, how the bones are in which condition, then further deeper analysis takes place to understand whether you have arranged the bones of the same person or the bones have different, compositions that do not match. So basically, you need to understand at that time also, and after, when you collect the evidence, when you just take it to the lab or take it to the forensic anthropology lab, there each and every metric and non-metric analysis takes place, and then the conclusions are written and given out in the report. Okay. So there is a teamwork, collaboration needs to be done because whenever a forensic team is at work, an anthropologist, a pathologist, even if it is an archaeological site, an archaeologist, these all people are required, right? So the evidence needs to be preserved, even in case of forensic anthropology, very, very, delicately, very cautiously, so that the chain of custody is also maintained and you're able to do the accurate interpretations. Okay. So as I said that there are certain, because we're talking about forensics, so yes, legal aspects need to be taken, need to be considered. And basically, when you are talking about the legal protocols, we have this chain of custody, evidence integrity, and when it's basically, when you are dealing with the bones of a person, now that person is dead, whether it's a person, whether it's an animal, it's your responsibility to basically respect the decedent's rights. To have an humanitarian approach so that you are not disrespecting the bones, disrespecting the body in any or the other way, and you are handling it cautiously because it is your responsibility as a forensic anthropologist that you are ethical, that you are taking proper consent from the family members, you are trying to understand the culture's sensitivity, you are trying to have a transparency, and you are not trying to do anything else unethically. So that is very important. Okay, now we will understand the basic foundation. We'll go to the deeper levels now. So osteology kya hai basically? So, osteology is basically the study and when you are understanding the bones, the complete skeletal system, when you are trying to understand, okay, what is the structure, what could be the function, what are the sides, how it has actually developed, what could be the age, what could be the ancestry. So, whenever you are, trying to understand the bones properly, that comes under osteology in a nutshell. Okay. So, what are we actually dealing in osteology? We are trying to understand the age, the sex, the ancestry. Okay. We are trying to also understand whether any kind of a trauma has been inflicted on this bone, on the individual, whether there is any, you know, prevalent medical history. That also sometimes we get to know through the status of the bones. Now we are talking about the macroscopic analysis, right? Whatever we are seeing through our naked eyes. And whenever we have certain bone fragments, or we need to understand that, okay, what is actually inside the bone? What could be the cause? What could be, is there any pathology that we are not able to make out? So basically, we go for the microscopical analysis, right? When you are studying the bone in depth. Okay, as I said, we go for trauma pathological analysis as well. Why we are doing it? Because we need to know whether the skeletal trauma has, it was perimortem or it was a postmortem damage. Because perimortem is, basically just before death, and when basically the person has dead, the post-mortem damage that we are talking about, it's about the handling of the remains by any sort of animals or any sort of environmental conditions. Anything is happening to the skeletal remains when the body is, when the person is dead. So that all comes under the post-mortem damage. So it is very important to understand that whether the injuries were inflicted before death or after death, just before death, it is all very important. Even if you are documenting certain antemortem changes, for example, a person went through a surgery, right, for a skeletal surgery, in a way that that person just went for this knee replacement, anything, right? So basically, that is also a mark that you are able to make, you are able to understand it in the skeletal analysis. So that is also very important. Also, is there any infection, degenerative diseases? If you are trying to confirm, you also go for microscopical analysis. Needed if you are not having, proper history, you are not aware of any clue that, okay, this could be this person's body, right? Also, trauma timing, as I have already mentioned. This is very important. to understand, what happened to the body actually. Okay, now let's understand ancestry estimation. So we'll understand this in a little shorter way so that you don't get confused also, and you also get to know that okay, how practically you estimate the population, the ancestry origin. So I would firstly just like to mention this. You would have heard about estimation, determination. So when we are using these terms, right? So, whenever we are talking about sex, we basically say sex determination. And whenever we are talking about age, we say age estimation. So, what is the difference? So, basically, determination is somewhat, a more definite prediction, I won't say prediction, a more definite, conclusion towards, okay, this person could be male, this person could be female. You have two choices. This person could be male, this person could be female. So you can give a definite answer, a definite conclusion towards it. So we say determination, sex determination. And when we are talking about estimation, so estimation is basically an approximate idea. Okay. In age estimation, even if you talk about forensic odontology or any forensic branch through which forensic medicine, so whenever we are trying to estimate the age, right, we are not saying that this person is 25 years old. No. We basically say that this person's age lies between 22 to 27 years old. We give it a range, right? So basically, that's an approximate idea. We can't say it very definitely because there are standard deviations, there are many, many things, many limitations also. So we need to understand that we have a approximate range, right? We don't have a a proper answer. So in the similar way, we say that ancestry estimation and not ancestry determination. Okay. So in ancestry estimation, basically what are we saying that this person could be from this origin. This person could be from this origin. So why we are using estimation term here? Because nowadays, in the world, we have a lot of migrants. We have a lot of combinations of populations right now. So some person is, born and brought up somewhere else. That person migrates. For example, that person migrates to another country, another origin. That they adapt a certain sort of lifestyle. They have certain habits. So they also, functionally they get to adapt different characters. And that's why this somehow it depends upon the age as well, at what age they are going. So that traits are also visible in those people, right? So basically, and also even if you are living in a particular area or a region only, right? And in that region, you are, that region itself, that genes or whatever you call that particular area, that is also a mixture of a lot of, different sorts of populations. So that's why it's very difficult, but you can give it, an estimate. So that's why we use ancestry estimation. Okay, so why I am emphasizing on this, because whenever you are using certain, certain softwares or certain websites, or whenever we are trying to do certain studies, we get to know that, okay, for example, I am estimating the ancestry from particular skull, okay, from a particular skull, and I found it in India, right? In India only I found it, but I found certain traits in it that are basically matching with the Negroid population also. And whenever I'm putting it in the software, wherein you have a lot of, you know, algorithms, even AI is also being used, that okay, sets are used that these traits belong to this for this origin, these traits are for this origin. So that software is also giving mixed results. That okay, this person has traits from this population also, from this also, from this also. The thing that actually differentiates is that you get to know how much percentage or how much maximum traits are from a particular population, that how much dominant that population is in that ancestry estimation, right? So basically, uh, you need to understand that okay, this person has these traits dominant and these are also present, right? So we give an estimate in short. Okay. Okay, so these are the pictures of certain real skulls that I have taken. And this, if we are talking about three, populations. So we are considering European population that are also considered under Caucasoids, right? Asian Mongoloids and African Negroids. So basically, तीन हमारे ethnicity में we try to understand these three populations first, okay, and then we give certain whatever report we are, getting. Okay, so the thing is that firstly, if we talk basic traits, about the basic traits, we consider these three traits. Okay. We also have dental considerations. We are going to talk about that as well. So basically, if I'm talking about the eye sockets, now try to, analyze these eye sockets very nicely. Okay, so this is the European origin skull, and this skull has circular eye sockets, but you can see there are square margins. Okay, they are also termed as aviator sunglasses. So this is also a characteristic trait. So kind of, you can see this square margins, right? If I'm talking about the Asian population, they are somewhat circular. I hope you can appreciate it. Yes, these are certain circular in nature and they don't have particular, edges if you see it cleanly, right? And when I'm talking about the African or the Negroid, population, so basically these are somewhat rectangular. See, they are not exact rectangular, पूरा rectangle नहीं मिलेगा आपको, but you need to be very precise. You need to be, you need to understand the details. Okay, where is my cursor? Right. So this is basically rectangular. If you compare it, अब कभी कभार what happens that you are not able to understand कि अरे क्या shape है eye socket की. So you go for each and every detailing. Sometimes you use that magnifying glass as well. That okay, am I not able to understand the margins? Am I not able to, figure out whether it is squarish or rectangular? So that is important. Okay. Also, you can't depend on a single trait. As I said, even if you are using a software website, it has a particular sets of traits. Okay. For every trait, you need to give it a, you need to give an input towards it that, okay, this is the shape for this is the shape for this, and then you get a proper result. So eye sockets ka I hope समझ आ गया है, right? Now if we talk about the nose. So basically, if you are talking about, see, in Mongoloids or what we call the Asian population, you can see a proper heart is being formed, right? So heart is there and a less pronounced nasal bridge is there. Okay. But if we talk about this Caucasoid or European population, we have this narrow nose, narrow and basically high nasal aperture. You can appreciate it. Pronounced nasal bridge. High nasal aperture is basically C. It's longer. The nasal aperture is longer, right? Prominent nasal bridge भी है, narrow है shape. See, compare. If you compare, you understand it well, right? So this is for the European population. अगर हम बात करते हैं for the African population that are the negroids, this is very prominent कि हाँ they have wide nasal aperture, ठीक है, and a flat nasal bridge. See यहाँ पे थोड़ा सा प्रोनाउंस था और यहाँ पे फ्लैट है, बट आई थिंक ये आप इसमें अप्रिशिएट फिर भी नहीं कर सकते, बट यू कैन अंडरस्टैंड कि शेप ज्यादा वाइडर है नेजल अपर्चर्स. ओके ओके, इफ वी टॉक अबाउट द जॉ, ठीक है, सो जब भी यूरोपियन, इवन इफ you have certain friends from different countries, na, you can understand certain traits in the teeth, because teeth तो आपके वैसे भी visible है, right? You don't need a skull only for that. So teeth में तो बहुत easily you get to know थोड़ा बहुत कि हाँ this person, इसका origin के हिसाब से इसका trait match करता है. I have myself also observed certain people, so you can also observe that. See, so European population में small teeth, little bit smaller, जो teeth का normal size है उससे थोड़े small teeth होते हैं, and they are set closely together. See, you can't see much of the, gaps. तो ये close में रहेंगे and there will be short teeth, small teeth together. Okay. If I'm talking about the Asian population, एक बहुत prominent आपका होता है trait, that is shovel shaped incisors. We'll talk about it in our tomorrow's lecture. ठीक है, लेकिन shovel shaped incisor is basically, you know, when you have a shovel like shape behind the teeth, basically उसके अंदर की साइड, we call it the palatal aspect or the lingual aspect. ठीक है, तो वहां पे because upper incisors हैं तो अंदर की तरफ palate है, right? So we call it the palatal aspect. तो palatal aspect पे we see the shoveling. Okay, shoveling trait is there. And if I'm talking about the teeth are somewhat similar, or like, okay, they don't have a lot of, you know, proper prominence in the setting or arrangement of the teeth or the size of the teeth. ठीक है, जो prominently दिख रहा है यूरोपियंस में दिख रहा है that small teeth are set closely together. ठीक है, बहुत ज्यादा कम spaces हैं. And if we talk about the Africans, they have lot of diastemas. ठीक है, you will notice this. Diastema भी मिलेगा, and their teeth have basically, you know, their teeth are much larger in size. We call it hyperdontia in dentistry. So their teeth are longer. They have wider spaces. ठीक है, and the jaw also protrudes from the maxilla. Like they have a protruding jaw. If you see their faces also, you will be able to make out, okay, this person, yes, this person is from the African origin. So ये short में हमने समझा है इन तीनों traits को. Okay. So अब what happens? Okay, now let's first understand the dental wala characters also in short. So arch shape की, if we talk about the arch shape, it is parabolic. ठीक है, parabolic in Europeans, hyperbolic in Africans, and elliptical in Asian ancestry. Okay. So parabolic में क्या हो रहा है कि U shape का we have the arch U shaped in nature, that is narrower and longer. ठीक है, hyperbolic में we have wider and shorter arch. ठीक है, and elliptical is rounded oval shaped arch, जो कि हमने अपने, we must have seen it, right? So that is about the dental arch and the ancestry association, that how you can understand. So I'll just tell you one experience that I went to a conference some time back, and basically we were trying to understand the ancestry from, you know, the dental cast of each other. Okay, so basically, if I talk about my dentition, so my dentition has diastema, right? But I'm not from the African origin. Okay, so basically, there are traits, but that when I just put that in the software, you know, so that was indicating towards, okay, एक trait African ancestry का हो गया. Also, when I was analyzing the comprehensive traits, जब मैंने बाकी सारे traits को समझा, analyze करके उसको डाला, so I was able to understand that, okay, inclination मेरा Asian ancestry में ही दिखाता है. ठीक है, but बाकी traits ऐसे भी हैं जो कि दूसरे उनसे match करते हैं. Okay, even when I was doing it for my friends, that also, you know, we were able to understand ki, like my friend is there from Maharashtra, and she was basically trying to understand about this shape, the art shape in her caste. Okay, so we were doing this all together. It was a combined task. So her origin, according to the caste, was Caucasoid, and every other trait, you know, out of 10 traits, she had 4 traits of Caucasoids, 2 traits of something else, and uska mixed आया answer. So this is how sometimes you need to understand कि okay, mixed answers भी आते हैं. ठीक है, sometimes you don't get a clean, you know, कि ठीक है एक ही dominant ancestry है. So this also happens. We'll talk about this software tomorrow in the odontology wala part. Okay. Okay, so this is one study, recent study that I was just going through. And in this study, what they have done, they have tried to understand how the heart palate is different among different populations. अब हमने जो पढ़ा अभी पहले, that was basically for जो basic है कि ठीक है ये 3 होते हैं and इसमें ऐसा होता है. So that is also a data, right? That we are studying. That is also, you know, excuse me. That is also we are trying to understand okay, what was the traits, what were the traits for this individual, for this population. But what about the current timing and what about the newer populations that we are, seeing. So what they have done, they have tried to understand different populations. Okay, and one such different population that they considered was Malay Chinese cluster. Okay, Malaysian, Australian, European. They were trying to understand different populations जो कि जिसका data is not that very prevalent or very prominent जिसको हम अलग से पढ़ रहे हैं ऐसा नहीं है. तो this study was very interesting and इसमें what they found that in the Malay Chinese cluster they had lower palatal vault. In Europeans they have higher palatal vault. You can see the images. See, higher palatal vault है, lower palatal vault है, broader palate है, यहाँ पे narrow है, this is shorter, this is longer, right? More rounded, more angular. So these traits are basically, grouped and understood and documented after considering landmarks, after considering a lot of data from different populations. So if we have a lot of studies, research studies को अगर आप पढ़ते जाओगे तो आप समझोगे कि you can't say in only three origins ki ye this person belongs to this origin only or this. We need to have a lot of more studies. We need to understand that okay, every population has a differentiation and also every individual is different. You can't say upon one trait that this person has this origin in any or the other way. So you need to have studies and this is a very good study. So I would recommend you can read this. Okay, they have used the 3D models, the 3D scans, and that is actually very fascinating when you are trying to, understand each and every trait. जब हम 3D स्कैनिंग 3D प्रिंटिंग को इंक्लूड कर लेते हैं ना ट्रेट एनालिसिस में मेट्रिक ट्रेट हो तो चल जाता है कि वी आर जस्ट एनालाइजिंग ठीक है वी आर जस्ट ट्राइंग टू यूज विद द इंस्ट्रूमेंट्स बट व्हेन वी आर understanding the non-metric traits, morphological traits, na, then 3D scanning gives you a very much accurate and very proper morphology of that particular landmark. Okay, so we were talking about statistical methods. In this way that statistical methods कहाँ use हो रहे हैं? So basically अगर हम study की बात करते हैं तो उसमें भी statistics चाहिए हमें, right? So whenever we are talking about forensic anthropology ना तो statistics तो आप छोड़ ही नहीं सकते, right? If you have 4 traits, you need to understand कि कौन सा trait है जो मुझे better results दे रहा है, ठीक है? अब मुझे पता है, for example, I'm doing a study and I'm doing a study on 5 populations, ठीक है? अब 5 पॉपुलेशंस में मैंने 4 ट्रेड्स सोचे हैं कि मैं ये चारों ट्रेड्स इन पॉपुलेशंस में एनालाइज करूंगी. तो मुझे एक ट्रेड एक पॉपुलेशन में अलग मिलता है, किसी में अलग मिलता है, हर पॉपुलेशन में डिफरेंट डिफरेंट मिलता है, ठीक है. अब मैंने देखा कि एक ट्रेड है ऐसा जो कि सिर्फ इसी पॉपुलेशन में ज्यादा मुझे मिल रहा है और बाकी पॉपुलेशंस में मतलब मुझे स्पेसिफिसिटी मिल पा रही है, राइट, कि इस पॉपुलेशन में ज्यादा फॉर एग्जांपल हाइपरबोलिक ही है, ठीक है, डेंटल आर्च हाइपरबोलिक ही है, इसमें पैराबोलिक ही है. तो मुझे ये पता चल रहा है कि अच्छा डेंटल आर्च का जो कैरेक्टर है ना वो बहुत ज्यादा रिलायबल है, बहुत ज्यादा सिग्निफिकेंट है, दैट आई एम एबल टू अंडरस्टैंड कि उस ट्रेट से आई कैन फिगर आउट कि ओके दिस पर्सन इसकी ये पॉपुलेशन है तो ये बड़ा सिग्निफिकेंट है. तो ये बहुत जरूरी है हमारे लिए अंडरस्टैंड करना कि इफ वी हैव अ लॉट ऑफ ट्रेट्स ना एंड वी आर डूइंग अ रिसर्च स्टडी फॉर एग्जांपल, तो उसमें भी basically what we are trying to understand which parameter or which trait is prominent and which trait is giving us perfect, not perfect but very good results. Okay, so discriminant analysis is being done. PCA हम करते हैं. Machine learning तो अगर आप include कर दोगे तो that AI gives it another edge. But आप उस चीजों को तभी use कर सकते हो when you are aware about the basics. When you are aware कि you can't be overestimating anything or underestimating anything. ठीक है. So probable conclusions दिए जाते हैं इसमें. We don't have that deterministic conclusions. So we are estimating the ancestry, right? And we are also, statistics आपकी ज्यादा है तब करता है जब थोड़ा metric traits आपके पास हो, right? We have figures. अब non-metric traits हैं. That can be subjective also, right? So अब हम उसके बारे में भी बात करेंगे. Okay, so when we are considering sex determination, ठीक है, सेक्स डिटर्मिनेशन, अभी मैंने आपको बोला कि सेक्स डिटर्मिनेशन का बेसिकली हम डिटर्मिनेशन इसलिए कहते हैं क्योंकि हम कहीं ना कहीं थोड़ा डेफिनेट हैं उस कंक्लूजन के प्रति कि ओके इट कैन बी अ मेल और इट कैन बी अ फीमेल, ठीक है, लेकिन बट उसमें भी देयर आर डिटेल्स। द थिंग इज दैट वी ओनली हैव टू चॉइसेस इन दैट, ठीक है। ओके, सो अब हम अगर बात करते हैं सेक्स डिटर्मिनेशन की फ्रॉम अ स्केलेटन, सो यू ऑल मस्ट बी अवेयर कि जो क्रॉगमैन है दैट पर्सन एक्चुअली सेड दैट अगर हम एनालाइज करते हैं फुल स्केलेटन ऑफ अ मेल एंड अ फीमेल, वी कैन अंडरस्टैंड इट कंप्लीटली दैट ओके अगर हमारे पास एंटायर स्केलेटन है तो हम 100% ये बोल सकते हैं दैट दिस पर्सन इज अ मेल और दिस पर्सन इज अ फीमेल। See the probability, the probability of this is 100%. So 100% probability that if we can go then we will determine it ना कि ये या तो मेल है या फीमेल है, इसमें फिर estimation का चांस नहीं है, ठीक है। If we have the pelvis alone, pelvis is basically a very strong bone or a very strong parameter to analyze in case of determining the sex. अगर pelvis भी है हमारे पास सिर्फ तो we can go for 95% accuracy, ठीक है, कि 95% हम बता सकते हैं कि this is a male or this is a female. Okay. If I'm talking about only the skull, 92%. And Krogman has said if we have both the skull and the pelvis, the probability, the determination, the discrimination power is basically 98%. And only if we have the long bones, still we have 80% of this thing that okay, we can understand whether it is male or whether it is a female. क्लियर। सो अब हम बात करेंगे स्कल के बारे में। तो स्कल के बारे में हम जब भी बात करते हैं ना, व्हेन आई यूज्ड टू स्टडी अबाउट इट, ये तो मैंने बहुत छोटा टेबल डाला है, वी हैड 4 पेजेस बिकॉज आई ऑल्सो हैव अ मेडिकल बैकग्राउंड। सो वी हैड 4 पेजेस और 4 पेजेस से वो शुरू होता था। एंड इफ वी गो इन दोज, वो बुक्स जो बहुत डीप में जाती है, दैट एक्चुअली इंक्लूडेड 12 पेजेस कि एक एक ट्रेट में क्या क्या है मेल एंड फीमेल। बट जब हम पढ़ते हैं और जब हम उसको प्रैक्टिकली करते हैं, जब व्हेन आई वाज डूइंग द प्रैक्टिकल्स ना, व्हेन आई वेंट फॉर certain different programs और कई conferences में भी, when I actually held the skull, even if in my own laboratory that I had during my masters, तो उसमें भी in that laboratory in our institution we were actually given the real skulls. एंड उसमें हम जब एक एक ट्रेड समझते हैं ना, तो इट काइंड ऑफ यू गेट टू नो अ लॉट। प्रैक्टिकली आप समझते हो लेकिन आप कंफ्यूज भी बहुत ज्यादा होते हो बिकॉज इतने सारे ट्रेड्स हैं, तो आप समझते हो कि अब इसको कैसे हम मेल फीमेल बोले। तो व्हाट वी यूज टू लर्न कि बेसिकली ना मोटे मोटे जो मेन ट्रेड्स है ना, जस्ट लर्न दैट फर्स्ट, पहले उसको क्रैक करो, देन गो डीपर इनटू द रिपोर्ट एनालिसिस, रिपोर्ट मेकिंग, ठीक है। तो बेसिकली अब हम बात करेंगे उन मेन ट्रेड्स की, एंड देन उसको हम थोड़ा सा डीप करेंगे, ज्यादा डीप नहीं जाएंगे, लेकिन ये वो ट्रेड्स हैं दैट विल गिव यू अ क्रिस्प कि हाँ ये मेल हो सकता है, ये फीमेल हो सकता है। ओके, सो अगर हम बात करते हैं स्कल की, तो स्कल इज बेसिकली बिगर इन मेल्स एंड स्मॉलर इन फीमेल्स, ठीक है। और ये ट्रेट को अगर आप प्रैक्टिकली देखो, आपके पास एक ही स्कल है, आप कंपेयर नहीं कर रहे, ठीक है, आपको एक स्कल दे दिया एंड यू आर जस्ट बीइंग टोल्ड कि अब बताओ मेल है फीमेल है। तो आप उसका साइज अगर आप मेट्रिकली उसको करते हो, ठीक है, आप उसको क्रेनियल मेजरमेंट्स करते हो, तो आप एक दे सकते हो कि हाँ ये इतना आ रहा है, तो पॉसिबिलिटी है कि दैट दिस स्कल बिलोंग्स टू this skull could be a male, could be a female. अब हम सेक्स डिटर्मिनेशन लेकिन कब कर रहे हैं, जब हम एंथ्रोपोलॉजिकली बात करते हैं ना, एक केस वाइज, तो पहले एंसेस्ट्री होती है, देन हम सेक्स पे आते हैं, देन हम एज पे आते हैं, ठीक है। कभी कभार एज का क्लू हमें मिल जाता है पहले, तो ठीक है हम एज भी कर सकते हैं। बट अगर हम बिल्कुल क्लूलेस हैं, ठीक है, देन वी गो इन दिस ऑर्डर ओनली। तो अब मुझे एंसेस्ट्री पता है, अब एंसेस्ट्री का मुझसे मतलब एंसेस्ट्री मुझे कैसे बेनिफिट करेगी, हाउ विल आई जस्ट गेट द एडवांटेज ऑफ नोइंग द पॉपुलेशन ऑफ दैट स्कल, कि वो कहाँ से, उसका ओरिजिन क्या है, वो मुझे कैसे हेल्प करेगा। अब मुझे पता चल गया कि दिस द स्कल बिलोंग्स टू अ कॉकेसॉइड डोमिनेंट पॉपुलेशन, फॉर एग्जाम्पल यूरोपियन जो है, ठीक है। तो मेरे पास जितने वो रिसर्चेस उस पे हुए हैं, जो मेरे पास डाटा आ गया कि जो स्कल का साइज है वो इस रेंज में फॉल करता है, तो मैं उस स्कल के साइज में पहले जाऊंगी। और उस स्कल में भी किसी ने, अगर देर आर सर्टन स्टडीज जो मेल फीमेल पे हुई हैं, तो मैं उस डाटा को चेक करूंगी एंड उस चीज को मैं रेफरेंस लेके ये बताऊंगी कि ओके, जो रेंज आ रही है दैट इज फ्रॉम दैट कुड बी अ मेल, एंड जो ये रेंज है ये हो सकता है कोई फीमेल हो। ठीक है, दिस इज हाउ थिंग्स आर डन। क्योंकि हम पढ़ रहे हैं, जस्ट कर रहे हैं, ऐसा नहीं है। प्रैक्टिकली उस चीज को समझना बहुत जरूरी है। ओके, सो अगर हम उसको कंपेरेटिवली बात करें, दिस इज बिगर एंड दिस इज स्मॉलर। आर्किटेक्चर तो बहुत एक ऐसा ट्रेट है दैट इज एक्चुअली समवॉट वेरी गुड एंड वेरी रियलिस्टिक, कि हाँ देर इज अ रग्ड आर्किटेक्चर, उसमें ज्यादा आपको मार्किंग्स मिलेंगे मेल स्कल में, एंड फीमेल स्कल इज काइंड ऑफ स्मूदर। व्हेन यू टच द स्कल ना, यू आर एबल टू डिफरेंशिएट। आप टेक्सचर से कंसिस्टेंसी जो है ना आपके स्कल की, यू आर एबल टू अंडरस्टैंड कि हाँ ये स्मूदर है, ये रग्ड है। इफ आई एम टॉकिंग अबाउट द क्रेनियल मास, दैट इज डीपर। फीमेल्स में वो लेस डीपर है। ठीक है, टेम्पोरल रिज जो है दैट इज मोर प्रोमिनेंट इन मेल्स एंड लेस प्रोमिनेंट इन फीमेल्स। द supraorbital margin, this thing is sharper in females and not that sharp and kind of rounded in males. zygomatic bone है तो वो more pronounced है मेल्स में। सुपरसिलियरी आर्च है तो दैट इज ऑल्सो लार्ज एंड प्रोनाउंस्ड। ठीक है, अब एक अगर हम छोटी सी उस चीज को समझे ना, जो ज्यादातर यही है कि जो प्रोमिनेंसी है ना वो कुछ मैक्सिमम ट्रेड्स में मेल्स में दिखेगी आपको। टेम्पोरल रिज है, जाइगोमैटिक बोन है। ठीक है, कुछ भी है ना ऐसा जो कि दैट इज अ काइंड ऑफ अ रिज, और यू कैन से अ प्रोमिनेंट फीचर, जो फीचर आप टच कर सकते हो, जो ज्यादा अच्छे से आप जिसको अप्रिशिएट कर सको ना, वो ज्यादातर प्रोमिनेंसी उसकी मेल में दिखेगी आप, अगर हम उसको शॉर्ट में समझे तो, राइट। एंड मैंडिबल इज क्वाइट स्क्वायर्ड इन मेल एंड राउंडेड इन फीमेल। ठीक है, गोनियन एंगल जो है वो फ्लेयर्ड मिलेगा आपको मेल्स में, एंड इट इज लेस फ्लेयर्ड इन फीमेल्स। एक पिक्चर भी है मेरे पास, आई हैव टू पिक्चर्स एक्चुअली, उसको साथ साथ रिलेट करके आप समझ सकते हो। ठीक है, ओके, सो रॉबस्ट है मेल स्कल, फीमेल स्कल थोड़ा ग्रेसाइल है। ठीक है, क्योंकि आप अटैचमेंट्स का फर्क पड़ता है। ठीक है, ऑल्सो अब सुपराऑर्बिटल रिज की हम बात कर रहे थे, आप यहाँ देखो मेल्स में सुपराऑर्बिटल रिज जो है यहाँ पे ये कह रहा है। अब ना ये एक ऐसा ट्रेट है जो कि आपको ना अलग अलग जगह थोड़ा अलग अलग मिलता है, राइट। अब आप यहाँ देखो सुपराऑर्बिटल मार्जिन, सुपराऑर्बिटल रिज। ठीक है, ये जब मैंने एनालाइज करा था ना इन द रियल स्कल्स, नॉट ओनली वन और टू स्कल्स, जब कम से कम 7-8 स्कल्स मेल के, 7-8 स्कल्स फीमेल के मैंने देखे थे, तो सुपराऑर्बिटल रिज जो है ना ये फील किया जाता है। सो बेसिकली व्हेन यू फील इट ना, तो यू अंडरस्टैंड इन दिस एज, इस साइड की यहाँ पे थोड़ा सा ये शार्प होता है इन फीमेल्स, एंड इट इज लिटिल लेस शार्प इन मेल्स। ठीक है, अब ये यहाँ पे भी आपको पिक्चर से क्लियरली उतना नहीं समझ आ रहा होगा, लेकिन ये एक ऐसा ट्रेट है जो कि कुछ बुक्स में कुछ अलग बताता है, कुछ में अलग बताता है। बट अगर प्रैक्टिकली देखें तो सुपराऑर्बिटल जो रिजेस हैं उसमें प्रोमिनेंसी और शार्पनेस, जो शार्पनेस है ना, जब आप उसको टच करोगे यू कैन अंडरस्टैंड कि हाँ ये
Sorry for
फीमेल का है।
interruption, ma'am.
हाँ
Actually,
जी,
some students are facing in Hindi language, so can you continue in
ओके,
English?
या श्योर
Thank,
श्योर, नो प्रॉब्लम।
thank you so much, ma'am.
Okay, so when I'm talking about the supraorbital ridge, the supraorbital ridge is more sharper and prominent if we talk in the practical aspects, because this trait is somewhat very prominent in females, right? But in certain texts, you would understand that okay, they are basically writing that supraorbital ridges are slight, or not that good. So basically, you have to understand the margin. You have to feel the margin of the supraorbital ridges. Okay. So whenever you are feeling the margins, that is little sharper in females and rounded in males. Clear? Now, if I'm talking about, see, I was saying rugged skull. Okay, pronounced muscle attachments are there, right? So whenever we are having pronounced muscle attachments, and there are overall in the overall skull, if I'm talking about this lateral aspect, frontal aspect, any aspect, temporal aspect, parietal aspect, any aspect, now you will see this very clearly, especially in the frontal aspect and in the lateral aspect, key that basically the prominency, the muscle attachments are more pronounced in males, and less pronounced in females. Okay. Now we were saying ki square chin is there in males. See, yeah, I have already shared this. Okay. So mandible is squared and mandible is rounded. Okay. And chin wise भी if we talk now, so see, you can understand this is square. See, you can see the margins and this is rounded, right? If we are talking about the gonial angle, if we are talking about the gonial angle now, see, this is flared, right? Flared in males and basically not that much flared in females. यहाँ पे आपको दिख रहा होगा. I hope you can appreciate it here, right? Differences are very minute. You need to feel the skull to understand this. See, when we are studying this you know, in this theoretical aspect, now, then we are trying to understand and making certain figures. But when we are practically doing it, we actually understand that feeling each and every feature is very important if you are doing a anthropological work. Okay. Okay, then if we talk about square chin ho gaya, round chin is there. See the other features. Okay, so teeth are little larger in males and smaller in females. And if I talk about the canine, okay, canine is a very sexually dimorphic tooth in forensic odontology. Okay, why? Because the positioning, size, the morphology of canine is actually an indicator that provides us with the thing that okay, whether the person could be a male or could be a female, right? So the tooth, if I'm talking about the placement of the canine, na, just see this. See, this is canine here, right? And this is canine here. See, canine here, if you see it cleanly, you can't see much of it. You can see just this part. And if I'm talking about the female canine, so the part that is, distal, the part that is associated with the other tooth behind it, that part is also very much visible in this female, right? So the mesial positioning of this canine is much more appreciated in females and less appreciated in males. Also, males have larger teeth, larger canines, all right, and the prominency, the proper tips of the canines are actually more pronounced in females and less pronounced in males. Okay. Okay, so mastoid process is little bit medium to large in shape, and females have small to medium, right? Nasal aperture is high and thin, sharp margins are there. The nasal aperture is lower with wider, rounder margins. You can see this. Now, gonial angle is already done. Then less FQs on see. Okay. But you need to understand that when you have two skulls now, one male and one female, then still it is easier to differentiate that okay, whether it is a female skull or it is a male skull. But when you have a single skull, then how would you do that? Then it's quite difficult, right? Okay, one trait that was left was the sloping forehead is there in males, and the forehead is quite vertical in females, right? The bulges are there. Okay, I think I have covered this. Mastoid process. See, so basically, yeah, the shape I have mentioned here. Okay, so the mastoid process is like this in males and like this in females. Okay, so it is little bit, um, like shorter, but if you talk about the other things now, when you are analyzing the skull, you get to understand the muscle attachments are more prominent in males in this area as well, right? So basically, when you are trying to analyze any skull, just consider each and every trait. Okay, so Abhi, just recently what I had asked that if you have a single skull with you and you don't have a reference or a different skull of a different sex, right? You have a single skull. Now, how will you do it? So basically, this table, maximum people forget to, understand it, forget to consider it. It just remains in our books only. And I have taken this sometime back from a book only. Okay. And actually, when you are talking about a case, you're discussing a case with a forensic anthropologist now, even from a different country, that person is also always mentioning about this table that we are not, we are not that perfect in determining the non-metric traits. So basically, if I am having a single skull, then and if certain features are very nicely appreciable and certain features are not that nicely appreciated, so how will I, just report it? How will I document it? So for that, this table is many a times used, okay, by many anthropologists when they have cleanly, for example, let's take this one. Okay, we'll take this zygomatic process. Okay, then we'll understand. So zygomatic process, लिया जाए कौन सा लिया जाए चलो okay, we'll go with the zygomatic process. So zygomatic process is very low and has smooth surface in a female. Clear, we are aware with that. But if I have got a skull that has zygomatic process that is smoother, okay, the it is also lower, but it is not that low that we basically study. So lower is there, but I can't say that this much lower is there in a male also, or this can't be a male. I can't say definitely, right? So I give it a conclusion, probable female. Okay. And I'm just talking about one trait, but I cannot conclude based on one trait. For just making you understand, I'm trying to consider one trait. Okay. Then if I'm seeing that, the positioning, the zygomatic is medium, okay, the zygomatic process is placed in a medium position, but it has irregular surface. I can't see the smooth surface. So there are chances it could be a male, but it can't be said that if a female is there, she can't have irregular surface. Maybe she would have an irregular surface. So I am very much confused, then I give it a term and determine it. Okay. And if I have zygomatic process that is higher, that I can say, okay, ये higher है, it is higher, it could be a male, right? It there are chances it could be a male, and there are less chances that it could be a female. Higher chances there towards it could be a male, right? And irregular surface is there. Irregular surface is that much that okay, I can understand that this much irregularity on feeling the skull, on feeling the zygomatic process couldn't be seen in the females. So there are high chances the individual is a probable male. Okay. If I'm talking about a definite male, okay, we call it male or definite male. So in definite male, what we say that the zygomatic process is very high. It is having a very irregular surface. It is confirmed that it is from a male, or it is, you know, a definite male skull. Clear? So basically, in this way, we try to understand. If we see it in this way, what we do. Sometimes manuals are available which give us certain diagrams, certain boundaries, which help us understand that how it is actually visible in the skull. And this 1, 2, 3, 4, 5 is this only definite female, probable female, indeterminate, probable male, definite male, or only male, you can say. So in this way, for every trait, now there are certain manuals which give you proper, boundaries. You can also see those in certain books, right? So this is very important to understand that sometimes you don't get such clean features, and you can't be very much definite. But if I don't have, for example, this there is one skull that is obviously the origin or the gender would be a male or a female only, right? But if I'm talking about, understanding what could be the sex of that particular skull, I can get many traits that are indeterminate. Even I can get, for example, I have determined there are 22 traits, okay, that are female dominant, whether it falls in one or two, okay. There are two traits that are coming under three, indeterminate. This one. One, two, three, four, five. I hope you are understanding it. Okay. Two traits are basically from indeterminate, and one trait is from definite male or a probable male. So I can give it a conclusion that this person could be a female. Okay. Okay. All right. So now we are talking about certain different bones. So firstly, we have this pelvic bone. As we said, that it is very important to understand pelvis, right? Because it gives us a very good estimate of a very good, idea of the sex of that particular individual. So basically, if we talk in a nutshell about it and we consider each and every trait, but also learn the traits. I hope the discussions, whatever I did earlier, those discussions somehow, you know, just retained those traits into your minds because we were practically relating things, we were also relating the diagrams. Okay, so here, if I'm talking about a pelvis, what first traits we actually consider to understand the sexual dimorphism is that basically, firstly, we see that how is the pelvic inlet. This is a very clear cut sign. Okay, so basically, it is oval in females and it is little bit narrow or heart shaped in males. If I'm talking about the flaring of the ilia, right? So the females have laterally flared ilia and the males have superiorly flared ilia. So basically superior is direction, this direction, okay? And laterally is this direction. Going this way, males have ilia that are flared this way. But they are less flared than the female pelvis, okay? Also, it is shallower, it is deeper. The male pelvis has, a deeper circumference in that, and females have a shallower one. अब हम बात करते हैं basically now we are talking about each and every trait in it. Okay. Overall, as I said, we have significant lateral flare, and in males we have minimal flare. In if we are talking about the greater sciatic notch, okay, so it is wider and shallower in females, and it is basically, wider, oh, sorry, narrower and deeper in males. Auricular surface is quite elevated in females and it is flat in males. If we talk about the ventral arc, it is also a very, crisp point that if we are appreciating the ventral arc and that is present, there are very high chances the pelvis is of the female. And if it is not at all present, totally absent, it's a male. Or if it is, if you are seeing a slight presence of the ventral arc, then it could be a male. Okay. Subpubic concavity. So basically, females have a little bit more concave subpubic concavity and males have convex subpubic concavity. Now, if I'm talking about this pubic arch, okay, so pubic arch is wider in females and it is narrower in males, right? The tilting, if we talk about the tilting, there is an anterior tilting, okay? The anterior tilting is there in female pelvis and a vertical area where you can't appreciate a proper tilt that comes in the male pelvis. All right. Also, if we talk about the pubic bone, now, so pubic bone is basically long and squarish in females and it is short and rounded in males. Okay. Now you have so many features. You have ischiopubic ramus ridge, narrow, sharp, that is narrower, sharp, and in males it is little broad and flat. See, this you can learn, mug up, you can write, and you can even retain. But if we are considering certain, bones at in the lab or at the archaeological site, at that time you just go for certain crisp points that you remember, and then you go with the deeper analysis. Okay, if you are standing at an archaeological site and you need to understand that You need to figure out the male or female, sex of that particular skeleton and particular pelvis bone. If you have three pelvic bones, okay, and you need to figure out, okay, this is a male, this could be a male, this could be a female. Other bones are also there, right? So at that particular point, you can't go with 35 traits, you know. Then you should have a crisp knowledge of at least 8 traits, 7 to 8 traits. And that thing will give you, you will be able to sort the skeletons, the sex dimorphism could be done at that time very easily. And the detail analysis that needs to be done, that could be done in the lab. Okay. So the crisp points that you can remember, these are mentioned in this basically, the picture. So ilia, flaring of the ilia, the pelvic inlet. Okay, pelvic inlet is very important, guys. Okay. Pubic arch ka curve. Okay, these 3 points, narrower, wider, tilting. At least these particular points give you certain sort of clarity. Okay. Also, if you talk about the sacrum bone, na, sacrum bone is also a little bit denser in males and less dense in females. Okay. That also gives you a good idea about the sexual dimorphism. Okay. And of course, when you are analyzing each and every bone, then you go for the ridge, you go for the ventral arc, you go for sciatic notch. So overall, first go for these 4 5 traits. Then at that time only, when you are analyzing each and every bone, go for these traits. Okay. And when you are done with it, when you have particular conclusions for that, just arrange it, pack it up, and then go to the lab, then analyze each and every trait. This is how forensic anthropologists actually work. Okay. When I'll show you the case studies, um, I think day after tomorrow, at that time, we'll also see we'll see a practical case as well. I have the permissions from the author. Okay. So I'll show you that case also, that how they actually, do it at that time, and after that, how they do it. Okay. So that I'll show you. Now, this is one particular article in that pubic non-metric traits, when you how you are analyzing it in the practical scenario, when you have certain bones from the child population. Okay. So how you can understand that, what can be the degrees? See, 1 2 3 4 5 again. 1 2 3 4 5. What are 1 2 3 4 5? Definite female, probable female. Okay. Then we have indeterminate, probable male, definite male. Okay, so this is how people are trying to understand this. Okay, and they are trying to understand the traits. So you can read this article for the pubic non-metric traits, and you can understand. This picture is from that article only. Okay, so you can understand how they up. See, you here also certain things you can understand. That's why they have given this picture, right? But when we are feeling the bone, na, we get to know about it more clearly. Okay. Now we have the clavicle. See, clavicle may we generally consider this one trait, okay, and that is median rhomboid fossa. And that rhomboid fossa is more prominent in males and less prominent in females. Now, when we are studying about it, now there is no that particular clean picture. Diagram, you will find diagrams. You will find that, drawing diagrams. If I draw a clavicle, I just make certain, lines in it and just make a round. So that will look deeper and like that. But we are practically talking about this clavicle bone that is taken from an article. Okay. So basically, this clavicle bone is of a female. Okay, they have basically located the rhomboid fossa, the median rhomboid fossa, and in that you can't appreciate any sort of particular prominence or depression. Also, it's looking like the same, right? And in the male bone, this is the male clavicle. Here it is either very much pronounced or deeper, even elevated. So different, in this also different traits are visible, but a very crisp trait is that a pronounced rhomboid fossa is seen in the male clavicle. Okay. All right. So metric analysis is also very important. We were talking about the non-metric parts. Okay. And when, generally people do the studies now, when they are doing comprehensive long studies, they try to incorporate both non-metric and metric traits, right? So basically, when we are talking about the non-metric traits, we must also be aware about the metric traits, right? So metric traits, I was just talking about one case a few slides back, I was discussing a case, right? Wherein I just gave you an example that if I have two skulls, I got to know their ancestry, I have then figured out the sex also. Now I need to understand whether that person, how I can, give the estimate, how I can determine the sex. So how I can make an idea of it through certain metric traits. And metric traits, for example, we have cranial metric traits. I'll show. See, this is also from an article, research paper. Okay, see, in this way, they have used then kind of an inch tape, okay, but there are calipers, different calipers are also used here, right? Sliding caliper can also be used. So for every trade, you can use different instruments, okay? But when you are actually, trying to analyze, see, different anatomical landmarks are considered. For every landmark, there are particular lengths, particular measurements that are considered in the metric traits. Okay. So basically, when we are talking about the cranial index also, that is also calculated, metrically. So for that also, you get to know because of that metric trait. थोड़ा सा, if we consider the shape, then we can understand oligocephalic, brachycephalic, mesencephalic based on the particular non-metric morphological trait. But when we are considering the metric traits, we have the measurements, we have certain data, and with that data, we can understand that, okay, this range is particularly found in this population. So this population, this skull could be from this population. Further, if I have studies that shows that in males this range is there and in females this range is there, then also I can give an idea that okay, this person could be a female or could be a male. But sometimes the difference between the ranges is too much less that you can't very much reliably say based on the metric traits that whether it is a female or it is a male. Okay, so in that case, you need to understand the non-metric traits. So anthropology is complete osteology. When you are understanding metric, non-metric traits, comprehensive analysis is being done, then only you give a report, right? Okay, so I was talking about the metric analysis, and here also I have mentioned that the long bone dimensions and indices provide sex estimates using population specific standards. Ab yahan I have written sex estimates. You know why? I have mentioned already the five, categories. But still sexes to do hi hai. We have only two sex, right? Male and female majorly. So we say sex determination only, right? But population specific standards, regression models, these come from where? These come from the metric traits, from the metric analysis, right? When you have the certain figures, error ranges are also there. We need to report that as well if we are preparing a report. Forensic anthropologist does that always, right? So reference is always taken. Data sets are available. That's why only metric traits, help you. Okay. So metric traits के बारे में, as I said that there are certain metric traits for skulls. So similarly, there are certain metric traits for different bones, different long bones. Okay. So this is basically for the pelvis. There are different parameters. If we talk about the femur bone, we have femoral head diameter, femoral length, epicondylar width. Similarly, we have it for tibia and also for fibula, like this way. So you need to understand that, okay, every trait, if you have certain instruments, not only metrically or not only non-metrically, but also metrically, you can give an estimate. Okay. Again, we were into the theoretical bookish knowledge. Let's come out. Let's go into the real, real perspective of it. So the sex determination and length and stature estimation was being done in this study from just a sternum bone in Iran. Okay, and they considered both the metric and non-metric traits. And I think this article is a must read. So just try to read this article. Okay. So long bones में if we talk about certain, you know, uh, particular bones, so basically there is this femur also that we generally consider, right? And in male versus female femur, what all traits you can see. So as you all know that it is the strongest and the longest bone in our skeletal system, right? So it has certain traits that are these are basically the non-metric traits, the morphological traits. Okay, that when you see them, and this femur is many a times encountered in the archaeological or disaster victim identification wale cases. Disaster sites where you will see these cases, these bones, femur bones are many a times found. Okay, so at that time, if you are just collecting, recording the evidence at the scene of crime, at the archaeological site, at that time you don't have that much time that you are just taking out your calipers, taking out your instruments, and doing the metric analysis. No, at that time, non-metric traits, morphological traits are very important. Okay, so at that time you need to just understand the bone, feel the bone, and just put it out like it could be male, could be female, like that. So, what traits we have in the femur? So, the maximum length of the femur bone is longer in males and shorter in females. Okay. The diameter of head is higher in males and lower in females. Okay. Head circumference, right? The head circumference is higher in males and it is lower in females. Maximum mid-shaft anteroposterior diameter. Okay, I hope you can see my cursor. So mid-shaft anteroposterior diameter जो है that is higher, comparatively lower in females. अब ये high low क्या है? What is this? Basically, the high low is basically when you are able to understand comparatively. Okay, and when you are able to see that this is quite more higher, it is not the it can't be said that it is shorter or it is lower. When you are towards it that okay higher he it is towards a higher inclination, then you can put it into the probable male and this definite male when you are doing it in the lab as well, right? So basically this is how you try to understand the things. Mid shaft circumference is higher in males and it is lower in females. Distal epiphyseal breadth. Okay, so these are all things that are maximum things are higher in males and lower in females. Even if you talk about the weight, okay, I remember when I was doing my internship in Forensic Science Laboratory, Delhi. I got a case. I just didn't handle it myself itself because I was not allowed to do that at that time, and I was assisting my basically there met the people all who were there and doing it, the officers, right? So when I was there with them, they told me that you can feel they got the bones, okay, and they told me that we are going to isolate the DNA and we are just trying to figure out what samples are there so that we can do the analysis. So when I was handling them the remains, when I was opening the remains with them, I got it, and I was also opening the envelopes, the cardboard, the certain cardboard boxes were there, paper envelopes were there, and mostly paper envelopes, you have the bones. And even we got certain that plastic tubs, right? Usme bhi there were certain bones. Okay. So the guidelines change regularly, but also resources are important. At that time, I'm talking about 2022. At that time, um, there were certain bones. I saw them coming in the plastic, plastic, this tubs kind of plastic bottles, कह सकते हो आप, you can say plastic containers. Okay. So in that, when I was feeling the femur bone, I actually felt it that yes, I was actually segregating them, and there were 7 to 8 femur bones. Okay, when I was just segregating them, so I just felt it that yeah, this femur bone is heavier. This is so less heavier. Like it has so much less weight. So I remember it very nicely because these things only just give you a quite memorial moments that yeah, you will never forget this, right? So the female bones generally in femur, if you are talking about the femur bone now, the traits, the longer, heavier, higher, these traits are basically for the male femur only, and for female femur it is lower, less heavier. So these are quite easily differentiable. When you have a lot of bones, you can understand कि okay, probable female है or definite है. You can understand. Okay, so this is also I have taken it from a study. I think 2024 की study है, yes. Okay, so basically what they have done here, the green bone. See, understand it. Okay, here, the green bone and this is kind of a pink. So these are, sexual differences for different genders, right? So I'll show you this. In this study, now, what they did, they tried to understand the diameters. See the vertical diameter, the bicondylar width, okay, and the basically one second. Okay. So yeah, I'll just clarify. So this table is from a different study and this picture is from a different study. Okay. So these two things we need to understand just clearly. Okay. So the femur measurements, if we talk about the metric traits, right? So femur measurements mein what we actually see, इसमें भी undetermined category is there, right? So the vertical diameter of the head, it is greater than 46.5 mm, and in females it is less than 43.5 mm. And undetermined section 43.5 to 46.5 mm. So this I took this from an anthropologist's work only, that a new author came. Yeah. So basically, that person was had clearly mentioned that 46.5 mm in his study, he was able to figure out that whatever population you consider, or broadly, if you consider a lot of populations now, even the reference data and even his study data, that were actually coinciding, and they reached to a conclusion that when we have a greater than 46.5 mm vertical diameter of the head, okay, so basically that is male, and when we have this like this one, and that is a female. Bicondylar width, if it is greater than 76, it is 74 to 76 mm. So basically mm की बात हो रही है यहाँ पे, right? And here we have centimeters. Okay, so don't get confused, right? Okay, so this is how for every trait they were trying to, they gave it a metric data, and the ranges that are in between, they gave it an undetermined data as well. Nowadays, you will see this data in certain studies. Okay, so now this one is a different study. In this, what they were trying to do, they have analyzed many bones. Okay, and basically they were trying to figure out for the for the children between 4 to 18 years, right? So for every age, what was the change? For every trait, for every bone. So it is a very comprehensive study that they have done. So you can see each and every trait, this the length, you're talking about the length, the bicondylar width, if you talk about it, the head diameter, each and everything. So this is very important. Trochanter length, yes. Traits, see, the traits are similar, but the data is different. Okay, and these are two different studies. Just to make you understand how people do it, even in the software itself, they have done. Okay, I'll show you. See, this is the study from which I have taken the picture. This picture, this picture. Okay. Hmm. So basically, they have tried to analyze the bones. Okay, and basically, they have tried to not only figure out for a particular age group, they have tried to figure out traits for different age groups, right? Okay, now I'm talking about this humerus bone. So this is also from a study. They have taken the real bones. I have tried to, figure out and tried to incorporate the real bones, the real experiences, the real things. Because in text you will find everything, but when you have to, when you are at the crunch, when you are in the lab, what do you need to do? So when you are studying forensic anthropology, you need to think like a forensic anthropologist, right? You need to understand, you need to have that understanding. So basically, this is also from a research article wherein what they did, they have applied this method given by Rogers, okay, and you can find this. So basically, distal humerus, they have used the distal humerus and they have tried to non-metrically understand the sexual differences. Okay, so for male, for female, they have tried to figure out and give the metric, non-metric traits, morphologic traits for the sexual dimorphism. So I'll read it out for you and you will understand each and everything. Okay. All right. So for sex estimation from humerus. So they have written sex estimation, but you will also write you'll always write sex determination. Okay. Yeah. So the trochlear constriction in blue. See, see, they have tried to figure out this. This line in blue, right? So the trochlear constriction, that is the angle of the central part of the trochlea respect to the central axis of the humerus, tend to curve gradually and to a lesser extent in the masculine. See, right? It is more curved. Yeah. Okay. Then it is curved sharply and more accentuated in females. The trochlear symmetry, that is in red. See, the trochlear symmetry. The central part of the trochlea tends to be more symmetrical in the female humerus than in the male humerus. See, you can appreciate the shape, and here, see how much precisely people are using softwares. Also, they are taking pictures, they are doing it in the Adobe Photoshop or any sort of software so that they can figure out the morphology. Just by seeing in the naked eye, just feeling only also sometimes don't give you that proper morphological trait, proper shape, right? So these things are also being done these days. And this is very important. Okay. Hmm. Morphology of the olecran. Okay, olecranial fossa bhi hai isme. Yes. So we have these green lines olecranial fossa ke liye. So olecranon fossa is very important. ठीक है? Because if you understand this point na, in humerus, you actually understand that okay, uh, how you need to feel the bone. So when you are analyzing the olecranon fossa, when you are analyzing fossas na, you need to feel the bones. Okay. Now how they have done it, so it is usually more superficial and triangular in the male humerus. See, up when you are seeing the bone, you are feeling it. On feeling it, you can understand that okay, it is going triangular. But if you are not very sure, right? And if you want to, have a particular boundary of it, understand it, then you can just take your pictures and put it. Also, pictures you can also do it on the radiographs. These are being done from the radiographs only, right? And from the radiographs, you have the digital copies, so you won't be able to compromise the picture quality also, right? So you can do it. Also, if you want to measure it, you can measure it in different softwares as well, right? This is very common these days. So olecranon fossa, as they have mentioned, it is triangular in male humerus, and it is, okay, and it is quite oval in females, right? So this is their study, and based on this study, they have tried to analyze the real humerus bones that they had currently in their study they were utilizing, and that's how they did it. Okay, I'll just see if I hope this is clear. Okay, so this study, please go and study this because they have just considered the sternum bone. Okay, and from the sternum bone only, they have tried to analyze the sex, they have tried to analyze the stature. So this is a quite a unique study. Just try to read this article. Right? Okay, so yes, so at the end we have this last article again. See, I put up many articles in my presentation so that students get to know about how practically they have to do things, how researches are being going on. If they want to also do certain sort of researches, how they can go for it, and how the theoretical knowledge is related practically. So this is one study. These days, AI, ML, everything is going on at peaks, right? So this is one study that is also very interesting. You can read this as well. In this, basically, they have tried to determine the sex of the adults based on the cephalometric measurements, okay, of the mandibular symphysis. All right. And this particular one mandibular symphysis is enough for the study because for this symphysis, they have taken, different criterias. They have taken one bone, but for that, metric traits, non-metric traits, they have tried to train their model, they have tried to put up ML so that when anybody else is using it or when for future studies, for future, cases, forensic anthropologists are using it. So how it can be done. So this is how the detailings are important. Okay. So I hope today's lecture was insightful for every one of you. It was a little bit lengthy, but I tried to still, incorporate things in a subtle way, in shorter, crisp terms, so that you remember what you have studied. If I would have mentioned 30 traits and you don't even remember four or five, then that's no point, right? So I've mentioned 12 traits. If you have 12 traits, if you have eight traits, so you would have, remembered that. So thank you very much. And I hope I'll just see you in the next lecture now. So we are done for the day.
Everyone, if you have any questions, you can unmute your mic and ask.
You're welcome.
Okay, so if you don't have any questions, so thank you so much, ma'am, for such an informative and insightful session. We truly appreciate your valuable time and guidance. Thank you to all the participants for joining today's session. We will continue the remaining topic in the tomorrow's session. With this, we conclude today's session. Have a great evening ahead. Thank you.
Thank you so much. Thank you, everyone.
Thank you, ma'am.